Hello and welcome to the second half of the appendicular skeleton. Last time we went over the pectoral girdle and the upper limb. Today we're going over the pelvic girdle and the lower limb. Well, if you look at the pelvic girdle and the lower limb, you can see it here in red. And if you notice, the pelvic girdle does not go all the way around. If you look to the picture on the right, you can see it goes about 2/3 of the way around. If you put in what's missing, you actually get the pelvis. So the pelvis is the pectoral girdle plus the sacrum and the coccyx. And we'll talk about the pelvis a little bit later on. But let's look at this pelvic girdle. So the pelvic girdle is attached to the axial skeleton at the sacrum. And there's a joint there, which we'll see in a little while, called the sacroiliac joint. If you look at this pelvic girdle, is composed of two COXAL bones. And here's what a COXAL bone looks like. So if you look at the COXAL bone in an adult, it's just one bone. But if you look at it in a child, it's actually three bones. Those three bones fuse together. In a child, we have these three separate bones. One is called the ilium, another is called the ischium, and the other is called the pubis. Well, even though they're not three bones anymore in the adult, we still use these terms. And so we still call this upper flaring portion the ilium, and we still call this back portion the ischium, and this portion in the front the pubis. They all come together right here. This is the hip socket, and the hip socket is actually called the acetabulum. That word means vinegar cup. It reminded somebody of the cup that the Romans and Italians keep on their dinner table. And in that cup, they would put wine with spices in it, or vinegar with spices, or maybe olive oil. We still call it this acetabulum. If you look inside the acetabulum, you can see the seam where these three bones join together. When we look at this bone, this is a lateral view. And the reason it's easy to tell it's a lateral view is because we can see the hip socket. If we flip it around to look at the medial view, you would not be able to see this hip socket. Well, when you go to talk about the structures of this bone, it's important to know directions. So the way I have this bone here is the superior is up, the inferior is down, anterior is over to the left, and posterior is to the right. Well, the way I can tell that is by this. If you look at this, there's a big notch here. It's called the greater sciatic notch, and we'll come back to it a little bit later. But this notch, this greater sciatic notch, is always posterior. And so if this is the posterior side, everything on this side is going to be posterior. And that makes this side the anterior side. So everything on this side is going to be anterior. Well, keeping in mind the posterior and anterior, if you look at this upper portion, remember that's called the ilium, you should see four bumps. There's a bump right here. That bump is to the front and to the top. It's called the anterior superior iliac spine. Iliac for ilium, anterior for front, superior for top. It's called a spine because it sticks out. And so there's another one here. So this is the anterior inferior iliac spine. There's another one here. This is the posterior superior iliac spine. And then finally there's this one, which is the posterior inferior iliac spine. So we have these four spines, and you can see these from both directions. The next thing is, if you look at the top of the bone right here, you can see that it's a wide edge, and a wide edge of a bone is usually called a crest. And so this is the ilium, so this wide edge is the iliac crest. If you can come down to the bottom of the ilium, that's where that greater sciatic notch is. And the reason it's called that is because a nerve goes through here, the largest nerve in your body. The largest nerve in your body is the sciatic, and it's about the size of a finger. That's how big it is. If you look just inferior to that, you're going to find another spine. But this spine is not on the ilium, it's on the ischium, and so it's called the ischial spine. Just inferior to that is another notch, and another part of the sciatic goes through here, but it's not as much, and it's not as big, so this is the lesser sciatic notch. If you continue moving inferiorly, you're going to get to a large bump. This bump is also very rough feeling, and rough feeling things on bones are usually called tuberosities. Well, this is on the ischium, so it's the ischial tuberosity. If we move anterior, you're going to see a large hole. The word for hole in bone is a foramen, and this one is shaped sort of like an obtuse triangle. So it's called the obturator foramen. If you continue to move anteriorly, you'll get to a bump. And a bump on a bone is sometimes called a tubercle. Well, this is on the pubis, so it's the pubic tubercle. So, if we review that, anterior superior, anterior inferior, posterior superior, posterior inferior, iliac spines. Greater sciatic notch, ischial spine, lesser sciatic notch, ischial tuberosity, obturator foramen, and then this pubic tubercle. And again, if you look at the very top, remember the very top is an expanded edge, and that's called the iliac crest. So, you should review each of these, and without any kind of word help on here, you should be able to name these things. And so I left this slide blank for you to practice with. Once you practice, then look at this one because it has all of them on there. Remember, this is a lateral view. We can see the hip socket. If you look at this picture, this is the picture that's in your lab book. And look, it's a lateral view. You can see the hip socket. It's also got 3 different colors here to show you the ilium, the ischium, and the pubis. And then you can see all of those other markings that we went over. There's a couple of extra markings on here that we did not cover. Remember, if it's not on your checklist, you're not responsible for it. If you flip it around, this is the medial view. And look, you can no longer see the hip socket. You can only see the hip socket from the lateral view. But if you look at the medial view, you can see most of the same things that we saw on the other side. So let's take a look at it. Here's a medial view. And so you should remember that we have these 4 bumps. They're on this ilium. We have the ischium. We have the pubis. If you look on the ilium, remember the way we tell anterior from posterior is the greater sciatic notch. But this is on the opposite side of that. So this is the anterior superior iliac spine. This is the posterior side. So this is the posterior superior iliac spine. Anterior inferior iliac spine, posterior inferior iliac spine. We can see those from both sides. We also have the greater sciatic notch. Again, that's where the sciatic nerve goes through, and that's always on the posterior side. And then here's the ischial spine, the lesser sciatic notch. This hole, remember, is the obturator foramen. And then the bump on the pubis is this pubic tubercle. There are a couple of things on this bone that you can see that you can't see on the other side. One of these is this. There's a ridge of bone that runs sort of arc-shaped. And so it's called the arcuate line. Another thing you can see on this side that you can't see on the other side is there's a big depression right here. Remember, the word for depression is fossa, and it's on the ilium. So this is the iliac fossa. And then finally, there's an ear shape right here, right where it says number 11. It's shaped like a human ear. And so look at it until you can see the human ear shape. Well, the word for ear is auricle, so this is called the auricular surface. So once you learn this side, flip it back around and look at this side. Once you learn this side, flip it back around and look at this side until you can find all those different things in different views. If you look in your lab book, you'll see both of these at the same time. So to the left, B, this is the lateral view. You can see this acetabulum. If you look to the right, C, this is the medial view, and you cannot see the acetabulum. Well, if you put two of those together, you get the pelvic girdle. Remember, if you put the part that's in between the pelvic girdle, between the two coxal bones, we're going to get a pelvis. So if you look at this, the word pelvis means bowl, and it looks like a bowl sort of with handles. Remember, there's a pelvic cavity, and you can see this pelvic cavity very easily now. And that is where we're going to find things like the bladder, the rectum, some reproductive organs, things like that. Well, if you look at this pelvis, again, it's two coxal bones plus the sacrum and the coccyx. Remember, the two coxal bones by themselves are the pelvic girdle. And each coxal bone, remember, is a fusion of the ilium, ischium, and pubis. So let's look at this pelvis. And so the pelvis is a strong, put together, very fused, strong structure. And again, the word pelvis means bowl, and you can see this bowl. Well, when you look at it, bowls have a rim. They have a brim. And so if you look at this blue dotted line, this is the brim of the bowl. It's the brim of the pelvis. It's also called the pelvic inlet. And we'll see why that is a little bit later on. Also in this view, you can see the sacroiliac joints. Remember, this is where the ilium is attached to the sacrum, and this is where this pelvic girdle is attached to the axial skeleton. Another thing you can see here is that right at the front, where the two pubic bones come together, there's an arch. You can also see the pubic tubercles. If you remember, those are those bumps, and so they're in the very front. And between these two, we're going to see a joint. So if you look at here, number 8 represents fibrocartilage. This is a fibrocartilage pad holding those bones together. It's called the pubic symphysis. And then if you look at the pubic tubercles, as they move away, we see these wide-edged bones here. Those are the pubic crests. Well, if you look at this pelvis, again, remember there's a brim. It's the edge of the bowl. And so there's some parts above the brim and there's some parts below the brim. If it's above the brim, it's called the false pelvis or the greater pelvis. And you can see it here in this bottom picture, and it's pink. If it's below the brim, it's called the true pelvis or the lesser pelvis. And you can see it here in this picture. It's blue. Well, remember we said the pelvic brim was also called the pelvic inlet. And there's a reason for that. The reason is because if a fetus is going to be born, it has to pass through the pelvis. Fetuses are normally born head first, and so the head is the first thing to enter this pelvic brim. It passes through the pelvis. And then if you look at the inferior side of the pelvis, you're going to see where it comes out. That's called the pelvic outlet. So we have a pelvic inlet, and we have a pelvic outlet. Well, remember, only one gender has labor and delivery, has a baby, and that's the female. So the female pelvis is adapted for childbirth. And so if you look at a male pelvis versus a female pelvis, they look very different. If you look at a male pelvis on the left, they're taller, they're narrower. It's much more strongly put together. If you look inside the opening, look how obstructed it is. It looks like nothing could get through there. If you look at the pubic arch, it's V-shaped, and you can see that at number 1. On the right, you can see a female pelvis, which is wider, it's shorter. If you look through the opening, it's much less obstructed. And if you look at the pubic arch, it's U-shaped. So there are a lot of differences between these two pelvises. Well, you're going to have to be able to tell one pelvis from the other. It's easy if they're both there at the same time. It's not so easy if you're just looking at one. So make sure you look at these different aspects of the two pelvi. Here they are side by side. So you can see how much taller the male is. Another thing you can notice is the shape of the obturator foramen. In the male, it's oval shaped. In the female, it's triangular shaped. The pelvis is not the only difference between male and female skeletons. In fact, all bones are different, but it's dramatically different in the skull. If you look at the male skull, it's much more robust, thick bones, high ridges, pronounced muscle attachments. The chin is square, the teeth are bigger, especially the canines. Whereas if you look at the female skull, it's much smaller, more graceful looking. The ridges are much less defined. There's a round chin, and the canines are much smaller. So let's look at the lower limb. So first we're going to look at the bone in the thigh. There's only one bone in the thigh, and it's called the femur. So the femur is a long bone. And long bones, remember from the previous video, have a diaphysis and they have two epiphyses. So one epiphysis is a proximal epiphysis, one is a distal one. Well, the proximal one here is the one that has the ball shape on it. That ball is called the head. And if you look in the center of the head, you're going to see a little pit. Well, the word for pit is fovea. So it's called the pit in the head, the fovea capitis. And then you're going to see a constricted area, that's the neck. This is actually the weakest area of this bone. And so a lot of people will break this bone, and they break it mostly here at the neck. Another thing you can see that there are two very large bumps on this end. They're called trochanters. And the femur is the only bone in the body with trochanters. One of them is bigger than the other one. So the one that is more proximal is the greater trochanter. It's bigger. The other one is smaller and it's more distal. This is the lesser trochanter. If you look down at the other end, it depends on whether you're looking at the anterior or posterior. But on the anterior side, there's a very smooth surface. And that surface is where the patella rides up and down as you bend your knee. And so it's called the patellar surface. If you flip the bone over, we're going to see that it looks different. But look at this view. You can see how it's connected to the pelvic girdle. And you can see that the ball fits into the acetabulum. And it forms a kind of a joint called a ball and socket joint. If you look here on the front side, which is coming around right now, it looks different than the back side. Well, here is the proximal epiphysis, front and back, anterior and posterior. Well, remember the trochanters. We have a greater trochanter, and you can see it from both sides. We have a lesser trochanter, and you can see it from both sides. But there's a ridge of bone that connects the two trochanters. On the anterior side, it's not very pronounced. It's called the intertrochanteric means between trochanters. Line. A line is a thin ridge of bone. But if you look on the posterior side, between the two trochanters, you see a very pronounced ridge of bone, a heavy ridge of bone. That's called a crest. And so this is the intertrochanteric crest, between trochanters, crest. And so you need to look back and forth between these two so that you can tell them apart. If we go back to our other picture here, you can even see that here. The posterior side, heavy ridges of bone. Anterior side, very light ridges of bone. So it's easy to tell anterior from posterior. If we flip the bone over, we can see the posterior femur, the whole length of it. Well, there's some things we already know. We know the head, we know the fovea capitis, we know the neck, and we know the trochanters. There's the larger one, that's the greater trochanter. There's the smaller one, that's the lesser trochanter. Remember, this is the posterior side, so between them is the intertrochanteric crest. If you feel this bone right here, it's going to feel rough. And remember, bones that feel rough we typically call tuberosities. Well, the gluteal muscles attach here, and so this is called the gluteal tuberosity. If you continue to feel the bone right here, it's also going to feel rough. It's going to feel like a straight line, and this is where the hamstrings muscles attach. This is called the linea aspera. If you follow it down to the distal end, what we see are 4 bumps. 2 big, round, smooth bumps. One is medial, one is lateral. And then 2 smaller bumps on top of those. Well, remember, if you have a bump on top of a bump, it's called an epicondyle. So now we need to know if it's medial or lateral. Well, the head is always on the medial side. So this is not the medial side, this is the other side. So this is the lateral epicondyle. This is the lateral condyle. So we have an epicondyle and a condyle. Same thing on the other side, except this is the medial side. So this is going to be the medial epicondyle, and this is going to be the medial condyle. In between the 2 condyles is a depression. Remember, the word for depression is fossa, so it's called the intercondylar, between condyles, fossa. So when you learn this side, you should flip it over and do the other side. And once you learn this side, you should flip it back over and do this side again. And keep doing that until you can name all of these different parts. So that's the femur. Don't forget that on the posterior side, there's a heavy ridge of bone. On the anterior side, a light ridge. And a light ridge is called a line. A heavy ridge is called a crest. You can also compare the bottom ends. If you look at the bottom ends, they look like this. So on the anterior side, we have this patellar surface. We also have the condyles. On the posterior side, remember, we have this intercondylar fossa or notch. And again, we have the condyles. Well, if you look at this picture, you can see that the condyles of the femur sit right on top of another bone. They sit right on top of this bone. It's called the tibia. If we go back and look at this, you can see that there are 2 bones in the lower leg. One is a medial bone. It's the big, heavy one. In this picture, it's red. And one is a lateral bone, and that's the one that's not colored. The medial bone is the weight-bearing bone. It's the tibia. The other one is the fibula, and there's no weight on the fibula. It's just there as a support. And mostly it supports the ankle. But let's look at the tibia. So here's the tibia. Well, remember the femur sets right on top of it. And so there's the two condyles of the femur. They set on top of flat surfaces on the tibia. These are called plateaus. So the condyles of the femur fit right on top of these plateaus. In between the two plateaus is a little ridge of bone called an intercondylar eminence. Well, the plateaus are actually part of a bigger section of bone called condyles. So if we look at the bone, we're going to see those condyles. One of them is going to be medial, one of them is going to be lateral. Well, they're hard to tell apart. But if you look down here, right here, you can see this finger-like projection. It's supposed to look like a little hammer. It's called the medial malleolus. Malleolus means little hammer. And it's on the medial side. So if that's the medial side, it's the medial side all the way up and down. So here's our two condyles. This is not on the same side as that one. So this is the lateral condyle. Here's the same side. That's the medial condyle. Again, they have these flat surfaces on top, which are called plateaus, and there's a little ridge of bone between them called the intercondylar eminence. Also, here you can see this. This is a rough feeling thing, and remember, rough feeling things are called tuberosities usually. This one is called the tibial tuberosity. And what attaches here is the patellar ligament, the ligament that connects this to the kneecap. We also have a sharp feeling part right here. This, some of us would call our shin, is called the anterior crest or anterior border. And then don't forget, down at the other end, we have this finger-like projection that looks like a hammer. It's called the medial malleolus. So that is the tibia. If we look at the other bone in the lower leg, remember this is called the fibula. Like the tibia, this is a long bone. And like all long bones, we're going to have a diaphysis in the middle and two epiphyses on the end. Well, if you look at the two epiphyses, they may look similar, but they're not exactly alike. This one, which is the distal epiphysis, is sort of pointy and looks like maybe an arrowhead. It's called the lateral little hammer, the lateral malleolus. The other end, which is more round and has a little concavity in it, is just called the head. We also have the patella. Remember, the patella is a sesamoid bone, and this is your kneecap. So, remember the tibia? Here's the tibia. We went through it. And then here's the fibula. Well, if you look at them, you can see these two together. And so on the left side, you can see the rounded head with the little concavity. On the right side, you can see this lateral malleolus, which looks more like an arrowhead. If you put those two together, look, there's a medial malleolus. That's on the tibia. And there's a lateral malleolus. That's on the fibula. And look at where they come together. It looks like an upside down U. And that's going to fit on top of the foot. So let's talk about the foot. So if you look at the foot, in this picture you can see that upside down U and how it fits across one of the bones. You can also see these two malleoli. The medial one, it's on the big toe side, it's on the tibia. The lateral one on the little toe side is on the fibula. And if you look at this, the lateral one is the bigger of the two. When you look at the foot, you're going to see three sets of bones, similar to the hand. These bones are called tarsals, and there's 7 of them. These bones are called metatarsals. These are long bones, and there are 5 of these. And then these bones are called phalanges, just like they were in the hand. And there are 14 of these. So if we add these together, 7 plus 5 plus 14, we get 26 bones. 26 bones in each foot. Well, if you remember from the previous video, the hand has 27. So there's 1 less bone in the foot than there is in the hand. And where it is here. Remember, there were 8 carpals, 2 rows of 4. But there are only 7 tarsals, a row of 4 and a row of 3. So let's look at these different bones. Well, here are tarsals, 7. Here are metatarsals, 5. And here are phalanges, 14. Well, you don't have to know anything about the foot except the names of these bones, very similarly to the way we did the hand. So let's look at the names of these bones. We'll do the easy ones first. So the metatarsals are just like the metacarpals. There are 5 of them, and they're just numbered 1, 2, 3, 4, 5. You have to start with the big toe. Remember, in the hand, we started with the thumb. And then with the phalanges, also very easy. Just like in the hand, there's a proximal, middle, and distal phalanx in every toe, except the big toe, which only has a proximal and a distal. The only ones that are hard are these. And again, it's because they're names. Well, if you look at this, remember it's 2 rows, a row of 4. And so you can see 3 green bones and a blue one. That's the row of 4. And then you can see a row of 3. And that's going to be the purple bone, the red bone, and the yellow bone. So let's look at this. Again, the names are not real easy. Here are the names. Medial, intermediate, lateral. Those are the cuneiforms. Cuboid, navicular, talus, calcaneus. And so to make that a little easier, we're going to use a mnemonic again. But remember, mnemonics, they have to be done in the right order or they don't work. So you have to go big toe to little toe, and you have to do the distal row first and then the proximal row. So the distal row is the row of 4. And here's our mnemonic. Well, first of all, let's look at 4. 1, 2, 3, 4. And then we're going to go back to the big toe, and what we're going to see is big, bigger, biggest. So 1, 2, 3, 4, that's our distal row. Big, bigger, biggest, that's our proximal row. And our mnemonic is going to be just like that. So our mnemonic is, my instructor lectures constantly. And then our rest of it is never to cease. So we go back here, 1, 2, 3, 4, is my instructor lectures constantly. Big, bigger, biggest is never to cease. My instructor lectures constantly, never to cease. Well, now let's go back and use the real words. So my instructor lectures constantly is medial, intermediate, lateral, and then constantly is cuboid. And then big, bigger, biggest, never to cease is navicular, talus, calcaneus. So if we go here, there's our rows, 1, 2, 3, 4, big, bigger, biggest. And then here, medial, intermediate, lateral, those are the cuneiforms, cuboid, and then big, bigger, biggest, navicular, talus, calcaneus. So when we look at it, remember we're going to do the distal row first. We're going to start on the big toe side. So there's the medial cuneiform. There's the intermediate cuneiform. And there's the lateral cuneiform. Cuneiform means wedge-shaped, and they're all wedge-shaped. There's 3 of them. And then we have the cuboid. Cuboid is cube-shaped. And then we have the proximal row, and we're going to go big, bigger, biggest. Well, this one's big. This is the navicular. This one's bigger. That's the talus. And this one is the biggest. That's the calcaneus. And that's your heel bone. So that's the foot. And that's the end of this show.